The book Atlas of Customized TMJ-Cranio-Jaw Prosthesis, Managing Temporomandibular Joint Disorders was published in 2025. The editor-in-chief is Kai Yang, with Harry Schwartz, Zixian Zhao, and Pan Lisa serving as associate editors. People's Medical Publishing House and Springer are listed as the publishers. In terms of content, this is primarily an atlas of oral and maxillofacial surgery, temporomandibular joint surgery, and cranio-maxillofacial reconstruction, with close connections to orthodontic surgery and digital planning. It is intended primarily for specialists, residents, and academic teams treating severe disorders of the temporomandibular joint, skull base, and mandible. The editor presents the book as a monograph based on experimental work conducted since 2009 and on many years of clinical experience at his center with custom-made prostheses. The subject is important because, when a joint can no longer be preserved, reconstruction must simultaneously address mandibular function, occlusion, deformity, and safety in relation to nerves and blood vessels. The book is organized in a logical sequence. History and classification precede anatomy, biomechanics, materials, manufacturing, and the digital workflow, followed by total joint replacement, its combination with orthodontic surgery, joint-preserving procedures, reconstruction of the joint together with the skull base or mandible, mandibular reconstruction with preservation of the condyle, and treatment of dislocations. The final chapter addresses contemporary technologies and devices used in clinical work. This structure allows the subject to be mastered systematically, although the subtitle may suggest that the book is a general textbook on temporomandibular disorders. It is not. Its focus is highly specialized reconstructive surgery. Its greatest practical value lies in the fact that reconstruction is not presented as an isolated implantation procedure, but as a chain of decisions extending from diagnosis to case follow-up. The authors integrate radiologic assessment, collaboration between the surgeon and engineer, virtual determination of the resection, defect modeling, prosthesis and surgical guide design, trial placement, quality control, surgery, and postoperative evaluation. Mechanical validation includes finite element analysis, static loading, fatigue testing of materials, and wear testing. Particularly educational is the presentation in the third chapter, which integrates a three-dimensional defect model, osteotomies, prosthesis design, surgical guides, and transfer of the planned screw positions into the operative field. The clinical recommendations are not all supported by the same level of evidence. The most important is that total temporomandibular joint replacement is not a treatment for routine pain or dysfunction, but an option for a joint that cannot be preserved, particularly in cases of severe osteoarthritis after failure of conservative treatment, marked condylar resorption, ankylosis, failed autologous reconstruction, certain non-reducible fractures, arthritic diseases, and tumors. The book also lists contraindications, including allergy to implant materials, active infection, and uncontrolled systemic disease. This principle is consistent with independent guidance from the National Institute for Health and Care Excellence, which requires patient selection in specialist centers, consideration of alternative options, and performance of the procedure by appropriately trained and experienced surgeons. A second important recommendation is individualized digital planning using surgical guides and close coordination between the surgeon and engineer. The technical rationale is strong, and the presented cases demonstrate a high degree of placement accuracy. However, this demonstrates that their system can be precise. It does not establish that a custom-made prosthesis is automatically superior to every stock prosthesis. A systematic review and meta-analysis published in 2025, including 42 observational studies and 2,221 patients, concluded that the overall superiority of patient-specific prostheses over stock systems remains unclear. A third important message is that, in patients with tumors and large defects, the prosthesis must be planned together with the resection, occlusion, soft tissues, muscle attachments, and future dental rehabilitation. The scientific foundation of the book is solid but uneven. The bibliography contains 100 references, ranging from historical sources to publications from 2024, including a systematic review and meta-analysis, prospective studies, biomechanical analyses, and case series. The bibliography also includes a randomized clinical trial, but it concerns arthroscopic disc repositioning rather than a direct comparison of patient-specific total joint prostheses. For the most recent designs, the evidence consists predominantly of prospective series, retrospective studies, biomechanical investigations, and experience from a single center. Epidemiologic data and randomized comparisons are not the principal foundation. The book does not use a formal system for grading certainty of evidence and occasionally moves from promising experience to recommendation more rapidly than would be expected in a methodologically rigorous clinical guideline. An independent systematic review from 2025 that sought direct comparisons between total alloplastic joint replacement and other treatments identified only one eligible comparative study. I would highlight 4 positive aspects of the book. The first is the integration of surgery and engineering. Anatomy and biomechanics are translated into concrete design and operative decisions. The second is its visual value. Magnetic resonance imaging and computed tomography scans, 3-dimensional reconstructions, diagrams, and intraoperative images make the procedures easier to understand. The third is the breadth of rare and complex cases, ranging from isolated joint reconstruction to combined defects involving the skull base and mandible. The fourth is the author's self-critical approach. They openly acknowledge that postoperative movements still do not reach physiologic values, that discrepancies exist between the digital plan and the actual outcome, and that large combined joint and mandibular prostheses have not yet produced satisfactory results. In 3 patients who underwent extensive combined reconstructions, they report complications including exposure or infection, instability, and problems related to muscle attachments. The principal weaknesses arise from the pioneering nature of the book. A substantial proportion of the innovations originate from a single center and from small case series, meaning that their generalizability has not been demonstrated to the same extent as their technical feasibility. The editor explicitly states that some of the devices presented have not yet received governmental approval and that multi-center studies are required for further validation. The book lacks a formal, evidence-graded algorithm that would clearly guide the clinician from diagnosis to the choice among conservative treatment, joint-preserving surgery, stock prostheses, and patient-specific prostheses. Communication with the patient remains a secondary topic. Concepts such as intelligent design, bionic prostheses, novel composites, and tissue engineering should be regarded as a research agenda rather than as the current standard of care. Based on the available sources, their future clinical effectiveness cannot yet be assessed reliably. For a dental student, the book provides a valuable insight into specialized reconstructive surgery, but it is not a foundational textbook. For a young dentist or general practitioner, its main value lies in understanding indications for referral. The greatest benefit will be gained by residents and specialists in oral and maxillofacial surgery, particularly those involved in temporomandibular joint surgery, orthodontic surgery, oncologic surgery, and cranio-maxillofacial reconstruction, as well as by university researchers. The 3 most important ideas that remain after reading the book are these. The joint should be replaced only when it truly cannot be preserved by other means and when alternative options have been considered. Precision is not a property of the prosthesis alone, but of the entire system from diagnosis to surgery. And in large defects, the long-term outcome depends on occlusion, soft tissues, muscle attachments, and stability just as much as on the geometric fit of the prosthesis. Does the book deserve a place in a professional library? For a specialist or academic center working in this field, yes. For a general dentist, it is not essential, and anyone looking for a practical guide to the everyday diagnosis and conservative management of temporomandibular disorders can reasonably skip it. Its greatest strength is its detailed, visually rich presentation of the entire individualized reconstructive process and of rare, complex cases. Its greatest weakness is the gap between the technological sophistication of some of the proposed solutions and the level of clinical evidence currently supporting them. It is best regarded as a specialist atlas and reference monograph with elements of a clinical guide, rather than as a universal guideline. If you are a surgeon making decisions about reconstruction of the temporomandibular joint, skull base, or mandible, this book is worth the time required to read it. If you do not practice this type of surgery, it is more rational to read selected chapters than to read the book from cover to cover.